Hi, Assalamualaikum. I am teacher Aisha. So today I'm going to present about the seizure disorder and epilepsy. So what is a seizure? Seizure is the sudden attack or recurrence of disease which is they lead to the temporary involuntary charge of consciousness, behavior, motor activity, sensations or autonomic function. Next is definitions for epilepsy. So what is epilepsy? Epilepsy is a chronic neurological conditions of recurrent seizures that occur with or without the presence of the other brain abnormalities. Okay, before we talk about the differences between epilepsy and seizure disorder, as we know that seizure disorder have a several type, which is generalized seizures, partial seizures, and mixed seizure disorder. So, this section is we talk about the differences. Okay. So firstly, we should talk about the epilepsy. The first one is chronic seizure. So epilepsy ni develop from a chronic seizure, which is seizure yang pelbagai dalam pada satu event yang sama. Okay, so bila terdapat berbagai jenis, and then dia akan lead kepada developnya epilepsy. Next is a neurological disorder that can affect different types of people. Okay, so as we know, epilepsy ni terjadi disebabkan several type of the seizure. So from the several type ni, they have different characters according to the types. So when a person get the epilepsy, this is because of based on what type they have attacked. Okay, so next is anti-epileptic drugs are used and not responding patients might need surgery. So epilepsy ni dapat dikawal, dapat disembuhkan dengan menggunakan drugs, which is ubat, anti-epileptic, and also the surgery. Okay, so next we talk about the seizure disorder. Seizure disorder is very common to the people because people know seizure, dalam bahasa Melayu dia sawan, because of the can affect people of all age. Okay, which is si sawan ni dapat daripada umur yang pada lingkungan kanak-kanak. So that's why they're very common to the people surrounding. Okay, so next is can occur randomly from different reason. Why? Because as we know, seizures ni adalah development seizures ni because of the genetic one, because of the surrounding yang akan trigger diorang punya seizures tu. So from the surrounding thing, dia akan trigger. That's why dia akan can occur randomly from different reasons. Next is do not need any treatment with anti-epileptic drugs or surgery, because seizures ni dapat dikawal dengan menggunakan cara kita kawal the surrounding, and also cara pemakanan also dapat mengurangkan seizures attack. Next we talk about the sign and symptom from seizure disorder and epilepsy. First is uncontrollable jerking movement of the arms and leg. Second, loss of consciousness and awareness. Third, tongue biting, urinary incontinence, and temporary confusion. Last is a mental symptom, which is fears and anxiety. Okay, this is the pictures of signs and symptom for seizures. So this is based on stages. They have 4 stages of the seizures, and the first one is aura stage. They have hallucination, confusion, dizziness, numbness, and distorted emotion. Next is tonic stage. Tonic stage, a person will have back arch, incontinence, stiff body, and epileptic cry. Next is clonic stage, jerky movement, forty saliva, and blinking eyes. And lastly is post-ictal stage, which is they start to calm. They have being weak limbs, exhaustion, and sleepy. Alright, this is the sign and symptom for epilepsy. A person will have staring and repeated rapid eye blinking, mostly after staring. Next is jerky movements of the body muscle, sudden loss of consciousness, unusual sleepiness, and irritability when woken up. Next is memory gaps, and lastly is a dazed behavior. Okay, for the next slide, we talk about the statistic according to the epilepsy people in the world. So first is people with epilepsy live in a low income, do not get treatment, is 80.2%. Epilepsy lying in low and middle income country is 24.2%. Premature death in people with epilepsy is 36.4%. And people living with epilepsy life seizure free is 21.2%. So di sini kita akan ambil point yang keempat, which is people living with epilepsy life seizures free. So di sini kita menceritakan who got siapa yang dapat treatment from beginning, they have a high chances to get the seizures free, which is a life seizure free. Next is a doctor management. So what we doctor do for treating the seizure disorder and epilepsy. The first one is before any procedure, they will do evaluation to determine the factors by checking the family history, medical history, and developmental history. Next, doctor will go to the electroencephalogram, EEG, to determine the type of seizures. Next, doctor will prescribe the medication to control factors ataupun the sign and symptom by 2 types of medication. First one is anticonvulsive to control the seizures, and also anti-epileptic to control the epilepsy. The last choice I have doctor management is a surgical intervention. So the surgical is provided because for the severe one. For example, is for the complex partial seizure, they will do the hemispherectomy by removal of most of one side of brain, which is they will remove the affected part to give the progression ataupun to get help back. So that's all for doctor management. Okay, to conclude, from research, there are 50 to 70% children can achieve complete seizure control with medication. Preventing head injury, for example, by reducing fall, traffic accidents, and sport injuries, is the most effective way to prevent the post-traumatic epilepsy. Last but not least, surrounding needs to be more alert and be toleration to the upcoming incident for minimize the stigma of prejudice and discrimination toward the epilepsy and seizure disorder.